Health is wealth, as it is the basis of economic productivity, political stability, social status, and above all, life reproduction of any nation. It is one common social factor that brings the human race together for a common interest and common front. Over the years, countries of the world have developed numerous institutions, systems, and practices as healthcare delivery system, cutting across international, regional bodies, national, states, local governments, and communities, and even family levels. Nigeria, with a population of about 120 million in 2000, and being the most populous on the African continent, coupled with its tremendous potentials of becoming an economic giant, it was bedeviled by a number of social crises as characterized by inadequate infrastructure, poor service delivery, leadership neglect, and systems failure, as portrayed by the United Nations Development Programme, UNDP Human Index of 2001. With an increasing concern from the nation's political leadership in turning around the Nigerian social sector to a viable and promising economy and stable political system, in addition to world and sub-regional bodies, numerous meetings, dialogues were held that eventually developed a framework for the health sector called the Health System Development Program, with the goal of raising the health status of all Nigerians by improving the performance of healthcare delivery at all levels. The scenario of nation's health sector indices, which was indeed challenging, the resurgence of malaria combined with HIV and AIDS, tuberculosis as co-epidemic, life expectancy at birth stands at 54 years, while infant mortality rate was 77 per 1,000 live births. In the same manner, 5 million in 5 years died before the age of 5. The high rate of mortality and morbidity among Nigerian children and related maternal death are indeed critical to the nation's health system development program. A 1999 multiple indicator clusters survey revealed that 15.3% of children between 0 to 5 years have experienced diarrhea, malnutrition, vaccine-preventable diseases, and malaria. Indeed, it is a clear reflection of inadequate access to obstetric care as a result of a number of factors. The Nigerian women record 10% of maternal death in the world, with 2.4 million live births annually, leading to death of 170,000 due to complications associated with pregnancy and childbirth. The Health System Development Program gave birth to the project under the three components that covers the 36 states and the Federal Capital Territory, as agreed among the African Development Bank, the federal government, and the World Bank, that the ADF support in Component 2 will be for 12 states spread across all geopolitical zones. The selection was not indeed without consideration as for financial and procurement capabilities, geographical representation, and population strength. With its high profile in international development programs and practices, Bauchi State became beneficiary of the Health System Development Program and steadily impacted on the lives of its over 4 million people. For the achievements of maximum performance, the program established a coordinated project implementation system with Directorate General Planning at federal level and Project Management Unit at the state level, responsible for the monitoring and managing the implementation of the project, in particular Component 1 and 2 of the African Development Fund. The Bauchi State Health System Development Project came on board as an executing agency under the auspices of the State Ministry of Health. Balabarde, a quantity surveyor by profession and health planning manager, is the project coordinator. He highlights the background of the project and its objectives.
The project is health-based project, which is called the Health System Development Project 2, and it's being co-financed by the World Bank and the African Development Bank. For the African Development Bank, they are financing the component 2 of the project with a credit amount of 3.5 UA, that is unit of account, which as at that time, at the time of signing the agreement, it was equivalent to 3.5 million US dollars. But with the upward fluctuation of the dollar, the amount has risen to 4 million US dollars equivalent. The overriding goals of the project is to assist the health authorities in redressing the deteriorating condition of healthcare delivery in the state due to long-term neglect by the previous or the military administration. So with the coming of the political dispensation, the World Bank and the African Development Bank intervene to assist the government towards that. The objectives of the project are two. One, that is under the African Development Bank component, is to strengthen the capacity of the system management at the state level. And the second objective is to support activities aiming at improving the delivery of healthcare services in the state, with particular emphasis on maternal and child health and reproductive health also.
A total of 14 facility centers have been identified and worked under ADF-ADB Component 2, Bara in Kirfi Local Government, Dul in Tafao Baleo Local Government, and Gwaram in Misau Local Government. Others are Urban Maternity Azare in Katagum Local Government, Sade in Darazo Local Government, Dagauda in Dambam Local Government, and Makawa in Zaki Local Government. In Ningi, Ganjua, and Bauchi local governments are Yadagungume, Mia, and Liman Katagum respectively. Galdimari, Polchi, and Gadao centers are in Jamaare, Das, and Itas Gadao local government areas, while School of Midwifery Bauchi, being the backbone of manpower for the primary health centers, is facility center. The project manager gives an insight into the facility centers and selection system.
We put more emphasis on hard-to-reach areas in the state because they are in a remote location and they have no access to healthcare delivery, and even if it means if there is any referral case, difficult for them to get to a nearby facility because of the difficult terrain and what have you.
These facility centers and hitherto collapsed structures with collapsed system in healthcare delivery services. The project focuses on rehabilitation and expansion, provision of equipments and furniture, power and water supply system, supply of basic drugs, and provision of ambulances for referral cases. A strategic system, the centers attracted for the presence of other healthcare intervention programs. The state ministries, hospitals, management boards, and local authorities are responsible for planning and coordination under the project provision. Alhaji Muhammad Yahya Jalam is the Bauchi State Commissioner of Health and described the project as a strong component to the overall healthcare program of Bauchi State.
The program is aimed at improving both the primary healthcare and the secondary healthcare system in the state. Towards this, they complement the effort of the states towards the improvement of health system in the primary healthcare, that is in the areas of the structure, building structure, the areas of providing equipment, and the areas of providing ambulances and other transportation modalities. These are not left only with the primary healthcare, because if you go down, a lot of primary healthcare system has been constructed, a lot of primary healthcare has been renovated, a lot of healthcare systems have been improved upon in terms of the facilities that are around, and additionally a lot of ambulances have been provided for some of these areas.
The permanent secretary of the ministry said the implementation of the project is strictly according to due process.
Number one, the profit margin is not much, but the money is there. So all the contractors deliver on time. And apart from that, we have done a lot of bid openings. Due process is followed to the latter. I have seen people that don't have any connection with any one of us being successful in the contract process. That is because if you have the necessary documents, due process is followed, you definitely get it. You don't need to come and see me. You don't need to say anything to me. If you have your papers in place and you have a competitive price, you get the contract. So, and apart from that, most of the standards set for, if it is building, it is followed to the latter. If it is supply, it is followed to the latter. I've seen so many goods delivered that were returned because they did not meet the standard of the World Bank. That is another plus for us.
The 14 facility centers are no doubt wearing a new look, with systems in outpatients, antenatal, birth delivery, routine immunization, emergency, and other auxiliary services as managed by trained nurses and midwives. Some of the officers attested to the improved facilities in their respective centers.
Health system program, we have benefited much. There are so many things that were not in existence in the hospital and it was not available. Some are not even functional. But with the coming of this health system development program, we are able to get so many things that is helping us in our activities. Like for instance, even the beds. Some of the beds before, the wheels have spoiled. So they brought beds for us, of which we admit our patients comfortably and carry out our work with it. We have fridge, which we keep our drugs inside. And even the patients, they benefit from taking cold water when they come. We want to drink water, there's water for them. You know, as Andre is very hot, it's a very hot and temperate area. So with this one, it is helping us.
The Katagum Primary Health Center has received a number of facilities under the Bauchi State Health System Development Project. So that include renovations and expansions of the buildings, bed and beddings, generator and water system. So these have improved our services to the community, especially in the area of outpatients, antenatal, routine immunizations, the NHIS program, etc.
So many items. These items include the equipment, the drugs, and they have renovated the clinic.
System development project, we have received the following items. Number one, we have beds. We have beds in the ward, about 6 beds in the ward. We have examination bed, and we have delivering beds too. We have refrigerator. We have about 3 refrigerators. We have 1 engine generator that is providing water and power supply in the hospital. We have wheelchairs, we have delivering kits, we have spigonal manometers, we have benches for patients to sit in the hospital.
Okay. The bed, supply generator to us, water system with our overhead tank, drugs, bed and others equipment was supplied to Gwaram Health facilities.
And that achievement that we have been done, we have a free drugs that government supply to us, and we are giving it free to the patient. And this it has been encouraged full of patients to this hospital. After that, we are rendering routine immunization in this health facility, and we are getting clients from Gado area to the almost border of Gado, that is Zaki local government and other part of this area. We are rendering all this under this hospital, and we have maternity section. We have delivery equipment that we have received from Bauchi State Government.
So we see the improvement because patients are patrolling this health facility. Why? Because the renovation, the lab set, the equipment and the drugs that they have been supplied to us free of charge.
In the hospital, a lot of equipment has been received by the Legoda primary health care. In terms of data equipment, we have it. Then the equipment that we use for diagnosis also, it is there available on the ground based on our level. You know, as a primary health care personnel, we will not go further than our limit. But the one that we will use it for our limit, most of it all we have it in this center, because Bauchi State Government has played vital roles in terms of that sector. Indeed, there is a lot of improvement. We have equipment with us. A lot of renovation has been made, which appreciated by all the community of Dagauda and the workers entirely. Even the renovation has been done. It's very good in structure. We are enjoying the structure, and the workers and other facilities are there available with us, whereby we are enjoying it.
The bottom line is the ability to translate the new drive to the benefiting communities, as improved services is now recorded at centers.
I receive all the necessary attention from the workers here. All the time that I need any assistance, they assist me fully. And I don't have any problem with them. They are giving me full cooperation. And I am now getting recovering as they are working with me here.
Ni na samu taimako tun da lokacin da aka ni ma bana iya jin daɗi sosai, faɗuwa nake yin nan. Amma yanzu na ɗan ci relief, gashi ina iya, na ji daɗi sosai. Har na ci abinci tun da ina kwana 3 ma ban ci abinci ba.
Gashi an gyara mana asibitoci, ga likitoci dare da rana in ka zo ba matsala kawai. abinda ka zo za ka
tafi wani kasa, abinda za ka nemi kuɗi ka nemi guzuri ka tafi kasa, ka ne tafi wani kasa, yanzu gashi ya zanto gashi a karkashin danganka za ka zo a duba mutum ka koma ga don ka kwanta. To ba wani damuwa ba wani matsala, har Allah ya kwana.
We improve our services because we get a lot of patients now to come with their sick of their health services. So we operate security service on daily patients to receive their treatment here.
With the health system development program supplies, in fact, it has assisted us in so many ways, like in the area of attending to our clients. Now when they come, even as they wait for us, they are seated comfortably. Before, some will not have even seat to stay because the benches may be full. But this time around, they have comfortable chairs waiting for us up to the time that we will call them in for their programs. Like fridge, as I said earlier, there are drugs that doesn't want high temperature and doesn't want light, of which we keep them inside the fridge. And our vaccines also are now safe inside the fridge, which is helping also in our day-to-day activities. Now when our patients come in, like those that come in for antenatal clinic, their cards, we keep it here as a record. When they come, it's easier for us to just open the drawer, pick their numbers and give them. But sometimes before we use carton, we just open a carton, put the cards inside. When they come, we remove it from the carton. But now it's inside safe inside the cupboard.
It's because of the improvement of facilities provided by the Bauchi State Government Bauchi State Health System Project. The Gwaram Primary Health Center recorded increase in number of patients, especially for antenatal attendance, antenatal clinic, and routine immunization. We improve routine immunization and antenatal attendance. Outpatients, we improve in coming. We receive many outpatients because of sometimes they used to post NYC doctors to us.
We really appreciate what the health system has done, and it has increased the services, more especially health services in this area. Formerly, this clinic is a health clinic. They have upgraded it to primary health center, whereby they have renovated it, equipped it with essential equipment and also essential drugs. We have no problems of drugs and equipment, so we really appreciate.
This internet is assisting us. You know, now we are in the age of science and technology. Almost always science is dynamic. Always we need elaboration and more skilled and knowledge. So this computer is helping us. By using this internet, we are acquiring more knowledge about our services, because whenever we have a problem, immediately we will come to computer and use it, then it will help us in getting the solution of our problem.
A community health committee was formed to complement in the maintenance, sustenance, and maximum utilization of facilities.
Now, women are trotting to the place to get health care. But all the same, some of them, you know what is difficult there, the difficulty to get there. There are some people are based on free drugs, there are some people are not, they pay for the expenses. But yet, they found that the amount we charge are minimum. Because we are so exorbitant, as like in the other chemists or in the other hospital. Therefore, we thank God the government gives us some money so that we can be utilized, revolving the money there. That's what.
Is a greater achievement to people like me and many others who are elsewhere. because this development is a development expected me and others to contribute to make. Allah in His mercy has made health system development to take care. Therefore, the light of this being an achieved project has been shown, because the name has risen from primary health center. I learned it is now a comprehensive health center. So it's a way forward in health development of Bauchi State in general. Secondly, the community and the people of Liman Katagum and around are fully aware of the existence of this health facility, from the renovation to the completion. And at the same time, the function is expected to be providing them. That is the health services that are expected. Thank God, if you go in, you see how mothers are bringing their children, you see how children are taking their various services expected to be provided under primary healthcare dispensation.
Get the order and the helmets. According to all of them, recently, very recently, according to all the geography and inform them what the function of the clinic. Also, we get the new abundant treatments, leprosy, TB, and SIV. So this let's comment. Let's Tuesday. Just what I will say. All the inform them we have opened the doors here.
Mu anamu bangaren mun fahimci cewa tunda mu shugabanni ne, kuma in jama'a mu suka samu koshin lafiya kuma suka zauna lafiya, mu ne muka zauna lafiya, mu muka ci gaba. In kuma aka samu rashin kwanciyar hankali da yawan cututtuka, to mu ne hankalinmu ba zai kwanta ba. To a sanadiyan haka, ganin cewa an inganta mana matsayin asibitinmu nan, kamar da na faɗa, ayyukan da aka zo aka gyaggyara asibitin nan, aka kawo mana magunguna, aka kuma kawo mana kayayyakin aiki. Mun yi amfani da daman da muka samu domin mu kafa wata kwamiti na lura da asibitin da kuma wayar da jama'a da kai domin su amfana da irin wayannan ayyuka da hukuma ta yi mana.
To bisa hoɓasar da ita gwamnatin jihar Bauchi a health system ta yi, mun samu ingantuwa wajen ainihin kansa shi ginin an ƙara shi, sannan mun zo mun samu ginin kamar yadda na faɗi kago ne sai da ma'aikata, a da babu likita. Haka ita health system gwamnatin jihar ta turo mana da likita wanda yake da wato ɗan bautan ƙasa. A yanzu asibitin bara muna da likita wanda wannan ya zo ya yi ya gama sabis nashi ya tafi, wannan ya zo ya yi ya gama sabis nashi ya tafi. Kuma kana nan a cikin wannan ɗan lokacin baya din nan mun samu kayayyaki wanda ya kama daga gadaje zuwa sauran kayayyaki da irin na aikin asibiti wanda kudinsa ya kai. To ganin haka, mu a matsayinmu na shugabannin gamayyar kungiyoyi na bara da kewayenta, mu kuma muka tashi don mu ba da gudunmawanmu wajen jawo hankalin jama'a don mu mori wannan facility ko kuma wannan aiki da ita health system ta mana.
The School of Midwifery Bauchi, being a facility center and the major source of manpower to health centers in the state, no doubt received a facelift under the project. Hajia Hasia Abubakar is the vice principal of the school.
Under the health system development, they supplied about 333 books in 2009 of different editions. Few of the textbooks include anatomy and physiology, pregnancy and childbirth, food and nutrition, gynecology by 10 teachers, medical microbiology, to mention but a few. And then they also supplied equipment to the practical room, equipment for practical purposes in 2007 and also 2009. Among the things they supplied, we have organs like the kidney, the heart, the liver, the brain. And then also they supplied things like adult weighing scale, sphygmomanometer, and then also we have benefited a lot in the area of capacity building because various tutors have been trained under the health system development in life-saving skills, prevention of hemorrhage, and also there has been retraining also, training of trainers, and also the trainers that have been trained has step-down training on those that were not trained. So we also benefited on that. And then also the health system renovated the entire hostel of School of Midwifery, Bauchi. The entire hostel was renovated in the year 2010. And they also supplied the offices, staff offices with furniture. And also they supplied computers, about 10 computers in 2008. And then in 2010 December, they installed VSAT, and they have also promised on Monday, 6th December, they will supply us with 20 additional computers.
As future managers of the health centers, some of the students could not hide their feelings on the development in their schools under the project.
It has assisted our learning in so many ways. First, like the provision of textbooks, it provides us with first-hand information about everything that we need to know. And also they've provided so many computers in which we can surf in and get very current information, because a midwife is supposed to have very current information at hand in case of some changes. And also they've provided facilities such as chairs and tables, which also helps our learning condition. They've provided a hostel accommodation. They've renovated our hostel, which also provides a conducive environment for us where learning can take place.
They have really assisted us. Like the computer they brought, we now have access to internet. Most of us that does not know, though we've seen computer before, but we don't know how to operate them. We can now go there and somebody will put us through and will know how to operate them. Like the models they brought, I think it's really a welcome development, because here before we only have access to so many models, but like the ones they brought, and I think it will help us in our practicals and it will help us to learn more. And like the hostel also that they've innovated, you know, when you breathe in good air and stay in good environment, that will still help you, you know, to learn more. I think they really tried, and we commend their effort.
Things they provided for us in the hostel, we really appreciate, because in the hostel we don't really have so many things like common room and the rest of them, but now we are able to have places to rest and relax our nose. Like in demonstration room, really thank them for providing the things for practicals. For now, we can be using it to practice before going into exam hall, and that will help us to improve in our exams.
Indeed, a new lease of life in the 14 facility centers. The numerous services on daily, weekly, and monthly services are recorded. The Commissioner of Health and Permanent Secretary, Minister of Health, expressed optimism that the project in Bauchi State has addressed some of the numerous problems of healthcare delivery in the state, and sustainability would be the watchword.
My perception to the project is a success, and it will continue to be a success, inshallah. Why? Because our executive governor has a sound belief in the project. In fact, that is the main key why there is a success in the project. If he did not believe in the project, it would never succeed. And look at how, as of today, if you go around, you will discover that in the primary healthcare center, we have over 1,000 primary healthcare centers existing in the state. He has succeeded in actually improving, reconstructing over 50% of it as of today. If you go around to the secondary facilities, As of today, 23 general hospitals in the state have been constructed, has been renovated, has been improved upon. So out of these 23 general hospitals, about 4 are presently in the process of actually being converted to specialist hospital. So to this end, I will plead with the benefiting communities to please, as a matter of urgency, ensure that this project is being safeguarded. Whoever they see coming towards messing up with this program, as far as they are concerned, they should take it upon themselves that it must be stopped. So that if they safeguard it, they should wait for another supply from other areas. Agriculture will come, education will come. Now that we have provided our health sector, so all these areas, as far as government is concerned, they will be made available for this.
Most of the facilities renovated had been provided with ambulances, generators. My advice to the local government is for sustainability. When the project falls off, we need to continue with what has been done. And we need to look after what has been given to us. Like the ambulances, they are very, very useful because they can transport patients from the rural areas to a secondary facility. And for the community, I'll call on them to guide jealously the facilities renovated in their community. They have to guide the equipment that have been placed in the various health centers, the ambulance. Once they guide this, there will be no misuse. If they see anybody misusing, definitely I know they will raise an alarm.
As the project comes to an end, what does the future stand for infrastructure, equipment, and other facilities in the healthcare centers? The project manager said it is just another stage and of course moving to the next stage.
If something is a project, that means it has a start date and a finishing date. So the health system development project is closing by end of this year 2010 December. So the issue of sustainability is another area which the government need to look into it. Though with the establishment of the primary healthcare development agency in the state, all the facilities, the health facilities that we intervene by renovating the health facility, providing them with generators and constructing boreholes and supplying them with drugs and basic medical equipment to all the facilities that we intervene. We, at the end of the day, hand them over to the primary healthcare development agency for sustainability, because they are on the ground. It's an agency which is on the ground, and its primary responsibility is on the primary healthcare. So we are handing over the facilities to primary healthcare, but there is need. It is important for the government to get a mechanism for sustainability, which is very important. Otherwise, all the effort, all the money invested into these facilities, at the end of the day, it will be a waste if there is no maintenance and there is no arrangement for sustainability.
The Health System Development Program, as conceived from series of meetings between the Nigerian government and African Development Bank, the World Bank in 2000, was effectively to reduce poverty through improved healthcare delivery with a view to developing the nation's human capacity. The project in Bauchi State, as one of the benefiting states, has no doubt impacted on the primary healthcare centers and of course to the benefiting communities with promises of improved economic performance, development of internal democracy and raising social status of the citizenry.